Hi everyone, my name is Beth Christopherson. I'm a psychotherapist in Houston, Texas, and today I'll be presenting on the CERT Afterlife Assessment Guide. This presentation is intended for mental health professionals. In 2018, Dr. Julie Beischel and I published a paper assessing afterlife beliefs in psychotherapy. In this paper, we introduced the CERT Afterlife Assessment Guide. The CERT consists of a set of sample questions that are organized around 4 concepts: significance, relationships, resources, and treatment. We'll be going over each of these concepts as well as some of the sample questions here in a moment. And because today is just an introductory class on the CERT, if you'd like to read more or follow up on this, please do access this free paper available through the journal Threshold. Okay, and so today I will be providing you some educational resources if you'd like to read further about any of the topics that we discuss, and just disclosing that I don't receive any financial compensation or have any financial relationships with any of those educational resources. Most of them are free anyway. Okay, so before we dive into the CERT, let's kind of take a look at the broader context. Why is it even important for mental health professionals to be able to assess and address afterlife beliefs? Well, we actually have quite a bit of data on afterlife beliefs. We know that afterlife beliefs are very common. About 3/4 of Americans have some kind of a belief in the afterlife. A Pew Research survey in 2015 found that about 18% of adults say they've seen or been in the presence of a ghost, and about 30% say they felt in touch with someone who has already died. A study by Dr. Kerr in 2014, he followed a group of hospice patients over a period of weeks. He found that the majority of persons in his study experienced an end-of-life dream or vision. So we know that not only are afterlife beliefs prevalent, but experiences in which an afterlife is encountered or perceived they're also very common. Today we're not going to have a chance, unfortunately, to delve into some of these different spiritual experiences like after-death communications, near-death experiences, shared death experiences, and end-of-life dreams and visions. But if you'd like to follow up and read some more, very likely that some of your clients will have had one or more of these experiences. IANDS, IANDS, International Association for Near-Death Studies, as well as the Windbridge Research Center, have a lot of free educational resources on their websites. Okay, so not only do we know that afterlife beliefs are prevalent, spiritual experiences with an afterlife is countered are very common. We also have quite a bit of research that shows there's a correlation between spirituality and psychological factors. So some of the studies have been done, or many of the studies were done in medical settings, and found that integrating spirituality into patient care had positive psychological results. Unfortunately, we don't have as many studies about afterlife beliefs in particular. I listed a couple here. AS 2014 study found that some kinds of afterlife beliefs are associated with buffering the individual against death anxiety. We have ample studies on continuing bonds research over the last few decades. And this leads us to this. It's probably too simple, not accurate for us to say religion and spirituality, afterlife beliefs, or continuing bonds are good or bad. There's a lot of nuance to this. I really like the way Carr and Sharp put it in this first bullet. The extent to which afterlife beliefs are protective or harmful may be contingent upon the nature and content of one's beliefs. And so the great thing about the psychotherapy setting is usually we have a little bit more time and we can establish that relationship, because many clients do want to talk about the nature and content of their spiritual beliefs, spiritual experiences, and afterlife beliefs in particular. But again, we just don't want to simplify it to the point where we're saying that all afterlife beliefs or all religious or spiritual beliefs are good or bad. There's a lot of nuance in there. And it looks like mental health professionals that we can do a better job assessing and addressing religion and spirituality. Quite a few studies showing that a lot of mental health professionals for a lot of very understandable reasons, are practicing spiritually avoidant care, lack of training, fear of undue influence, things like that. Dr. Oxhandler found in her study that the social workers who she surveyed reported that they were assessing religion and spirituality, but but they weren't necessarily following up with providing any resources or doing much with that information. So it's good for us to have more training and education in this area. All right, and so before we dive in, I like to think about approaching, bringing in religion and spirituality for clients who want to, bringing that into the therapy setting. Again, a lot of clients are going to want that holistic approach, and their religious and spiritual beliefs are very important to their mental health. And so I think this is a really great spectrum to keep in mind. This is Dr. Saunders' Spectrum of Spiritual Care. The reference is here if you'd like to read this article. I added the colors just for teaching purposes, but kind of if we think about going in too cold or too hot. So spiritually avoidant care, the therapist or the mental health professional may just be completely avoiding the topic of spirituality, religious beliefs, or if the client brings it up, the therapist may, for whatever reason of discomfort, shut it down. On the other end of the spectrum, mental health professionals, we have to be careful about not coming in too hot, not being too directive. Very normal for therapists to want to help people, but we want to be mindful we're not telling the client what to believe. An example of spiritually directive care might be telling the client how to pray or what scriptures to read. The sweet spot that most of the literature talks about is spiritual conscious care or spiritually integrated care. Again, Dr. Saunders here has written a lot about spiritually conscious care, and Kenneth Parkmount has written a lot about spiritually integrated care, if you'd like to read further about that. Okay, and of course, like any topic we approach in the therapy setting, we always want to approach it through our ethical knowledge and our ethical lens. In the NASW Code of Ethics, I'm a social worker, so this is my Code of Ethics. Religion is mentioned several times. You can pull up your Code of Ethics and do a find function and see where and how religion is mentioned in your Code of Ethics. All right, so here we go. Religion and spirituality is obviously kind of a very broad umbrella, and the good news is there's actually been a lot of religion and spirituality assessment tools for the psychotherapy and medical setting that have been developed over the last couple of decades. Unfortunately, a lot of those tools are completely lacking in questions about afterlife beliefs, or may just have one question. So the CERT was developed to really fill this gap, to fill this need, and it's based on the two-phase spirituality assessment that is already established in the literature. Again, please, by all means, copy down these references, wonderful books and articles to read to provide further information on this two-phase spirituality assessment. We're going to go over it briefly right now. So in the two-phase spirituality assessment, or religion and spirituality assessment, it's composed of this initial or preliminary assessment where the therapist is asking those initial questions, just getting the basic information. How do you identify religiously or spiritually? Are you part of any religious organizations? So you're getting that basic information to find out, does religion and spirituality matter to this client? And even if it matters, is it relevant to what the client would like some assistance with? And do they even want to talk about it further? So in some cases, you may only do a preliminary assessment. This is very similar when you're assessing and addressing things like money or intimacy. Sometimes after that initial assessment, you don't go any further. It's apparent there's no need to. But in many cases, there is a need. And so phase 2 is expanding into that comprehensive assessment. You might be using more open-ended questions in this part of the spirituality assessment. Again, there's a lot of measurement tools out there, as well as potentially employing a spiritual genogram. Okay, so the CERT Afterlife Assessment Guide is based on this two-phase assessment approach, and the CERT specifically looks at afterlife beliefs in particular. So the S is significance. Significance, again, we're looking at, are afterlife beliefs significant to our client? And so this is in the spirit of that initial or preliminary part of the assessment. Do afterlife beliefs matter to this client? Do they matter to what the client's seeking help for? And does the client want to talk about them further? All right, and so some sample questions for significance. So sorry, the whole the CERT guide is a series of sample questions organized within these 4 concepts. It's intended, these questions are intended for you to be modified. So please add, subtract, modify in a way that works best for you in your place of work and with your particular clients. This is really meant as questions as a starting point for thinking about being able to do that initial and comprehensive assessment in more depth. for afterlife beliefs in particular. All right, so some example significance questions for afterlife beliefs might be things like, first, just making sure you're using the language that feels true for the client. And then questions like, do you have any beliefs about the afterlife or about what happens after we die that you feel are important or that you'd like to share with me? Just asking the question normalizes it's okay for them to talk about that with you. And sometimes we can, before we ask the question, we can make a statement that's normalizing. So for example, in the fourth bullet down, some people report receiving a visit from the deceased in their dreams or experiencing a sense of presence when awake. Have you had a spiritual experience similar to this? And so this significance portion, this initial part of the assessment for afterlife beliefs, you're creating that warm and inviting space. You're letting the client know you'd love to hear more if they'd like to share it. It's a warm space. It's a safe space where they can share spiritual experiences that maybe the client was met with negativity with someone else or didn't feel comfortable in another setting. So if it's clear that afterlife beliefs are important to the client and they'd like to talk to them further, you may be, again, moving into that more comprehensive assessment and looking at other aspects of afterlife beliefs, how they're affecting their life, and how you can assist. So relationships is the first R. As therapists, I think what we do as therapists is help people with relationships, whether it's relationship to self, relationship to work, relationship to friends, to families, to values, ideas, concepts. We're doing the best we can to help people in their relationships. And it's no different when it comes to relationships with the deceased. And I think we can keep in mind that even if someone doesn't have a belief in like a living soul or survival of consciousness, many people are going to continue a relationship with the memory or legacy of the departed, and that may be a very important aspect of their life, even if they don't necessarily, again, believe in like a living soul. All right, and so some example questions for relationships might be things like, are there any gestures or rituals in which you like to engage that honor your deceased loved ones? Or really getting that sense of meaning. So in the fifth bullet down, do your beliefs about the afterlife help you to make sense of or obtain meaning from whatever event may have occurred or that they're seeking assistance from? Asking a little bit more how, if they've had a spiritual experience, how that affected their relationship with their deceased loved one. This is also a time when we're assessing relationships where trauma symptoms may become evident. My anecdotal experience is that many clients who seek out grief therapy are not just missing or longing for their loved one. They often are seeking help because they're having intrusions. They're having flashbacks, or maybe some negative memories of if someone suffered before they pass. That's coming in intrusively, and so I think it's really important that therapists can recognize those trauma symptoms, those intrusions. Sometimes there's the ruminations of coulda, shoulda, woulda. And that the way we approach those, the traumatic and which are very normal symptoms. So trauma is normal after watching a loved one having pain or having suffered or losing a loved one. So some of those traumatic responses again are very normal, but how we approach them, how we help a client with that is going to look really different from if a client says, I haven't been able to tell anybody this before, but I was putting on my clothes a couple years ago in the bedroom, and I looked up from my bed, and in the doorway I saw my mom who'd passed away 5 years before, and she was smiling at me. So those are two cases, the trauma symptoms and the after-death communication. They both involve the relationship aspect, but they can have very different effects, and how we assist the client may look very different. The spiritual genogram is a really cool tool that can be used with some clients. It's great, especially clients who really like visual things, who like to draw things out. It can be done with the therapist or on their own. I wrote this hypothetical spiritual genogram, but David Hodge has written multiple articles on the spiritual genogram. I put a reference here for you if you'd like to read some more about those. It can be used to help identify how relationships have changed, what spiritual relationships are most important, whether that's with the deceased, whether it's with an organization. Some people have close relationships not only with departed loved ones, but maybe angels or saints or things, kind of the sacred dead, as Dr. Klass has referred to them as. And this can be a really helpful tool for gaining more information. And that leads us to also finding if there is a gap in resources as well. Wanted to provide you with this resource. Again, so much great research has been done on continuing bonds over the last few decades. In 2018, this book, Continuing Bonds on Bereavement, was published, and it covers a lot of continuing bonds across the globe. So it looks more at, it covers diversity, and not only diversity of culture and how they relate to continuing bonds, but also things from how continuing bonds might express with technology, even people seeking out mediums, and how that relates to the relationship with the deceased as well. Okay, and so again, we're gathering information just by listening and normalizing. That can have healing effects, but also looking into some other ways that afterlife beliefs may be integrated into helping our clients heal. Resources. So really with anything, whether you're helping a client with intimacy, with other forms of health, with sometimes couples may argue over money, for example. Resources are a very normal thing for mental health professionals to provide. It's no different with afterlife beliefs. And so I just want to point out that a resource is not required. So a client isn't required to follow up on a resource to continue therapy. I separate this out from a referral in the sense that sometimes referrals, continuing therapy is contingent upon the client following through with a referral. For example, maybe following through on getting substance abuse treatment. So right now we're talking about resources. Keeping in mind a way to do it ethically is going to be, how can we be good matchmakers? And so we want to do a good biopsychosocial spiritual assessment with the clients. We really know our client and what they have and what they might need, what they're asking for, and also be familiar with our resource so we can make that good linkage, that good match, and letting the client know why this resource might be helpful to them and that there's no requirement that they follow through. A specific example of this chart came out of the paper, again, that was published. Again, it's free online, it's open access, but I do want to just give a specific example. Many of you may have worked with clients who were in a bereavement group, a very supportive bereavement group, but maybe it was one in which they felt like they couldn't talk about their afterlife beliefs, or they had a powerful after-death communication, and they didn't feel comfortable discussing it in that particular group. Groups like Forever Family Foundation, Helping Parents Heal, IANS has groups for near-death experiencers. So some organizations are going to be really friendly, really open, provide resources, normalization if a client is needing a resource of just more support, knowing they're not alone, talking about this with other experiencers. All right, so some sample questions for resources might be, do you have friends or family or a clergy person with whom you can discuss your beliefs about the afterlife? And asking the client, finding out, do they want you to provide resources? And if so, would they prefer more discussion about religious resources that might work for them, or would they like more scientific research and resources? Again, some people are going to have a spiritual experience and it will be filtered and understood through their religious upbringing and their religious lens. That's great. And other people may have a very similar experience, but for them what's going to work is they need to know they're not alone, and they might want to read more about, what the heck just happened? How is this possible? And so providing them resources for scientific research on hypotheses regarding survival of consciousness. All right, and the T insert is treatment. So here again, we're really kind of looking at our loose ends, making sure that we're really if the client, again, if it's important for them to be able to integrate their afterlife beliefs, questions, struggles, experiences, that we're doing it in a way that works for them. And so we're providing them an opportunity to share additional ways that their afterlife beliefs may incorporate it into their care. And we might be having a discussion with them of how we can, how we might suggest it be integrated into some of the approaches that could be being used for, again, for trauma. Some therapists use EMDR, cognitive behavioral, the narrative approach, letter writing to the deceased. Almost any approach I can think of, afterlife beliefs could be very relevant to, and important that the client can discuss them and bring them up to get the most out of using any of those approaches or conceptualizations. Okay, and so some sample questions might be, how may I best support you in our work together regarding your afterlife beliefs? Or how can I incorporate the wisdom you obtain from your spiritual experience into our work together? And again, obviously there's a lot of diversity for those of you mental health professionals who are listening, and the modalities you use, and it can be an opportunity to talk about how they might specifically be used in a modality as far as for that particular client. All right, and so I know this was a brief overview, but just to quickly summarize, afterlife beliefs and spiritual experiences, we have a lot of research to show they're both very prevalent. We know that mental health professionals may be practicing spiritually avoidant care, especially when it comes to afterlife beliefs, so it's good for us to have more education and training. The CERT provides further research, options, and ethics to consider when assessing and addressing afterlife beliefs and spiritual experiences. Again, that paper is available for free online. And the CERT Afterlife Assessment Guide provides an initial resource for mental health professionals to collaborate regarding assessing and addressing afterlife beliefs. Thank you so much for listening. I hope you have a wonderful day. Bye-bye.